Okay, let's just dive right into this explainer because we really need to talk about a truly terrifying feeling. Imagine you're living with COPD or heart failure, and suddenly you are just desperately gasping for air. Your very first instinct is probably to reach for an oxygen mask, right? I mean, it makes total sense. But what if medical science says that might not actually help? Let's unpack the science of breathlessness today and look at exactly why oxygen might not be the silver bullet you think it is.
This is the exact question we hear from so many patients. You're probably thinking, look, I have COPD, I have heart failure, and I am literally gasping for oxygen here. So taking extra oxygen is definitely going to help my breathlessness. Am I right? First off, we need to validate that what you are feeling is absolutely real. That sensation of air hunger is exhausting, and quite frankly, it's frightening. But we really need to explore why oxygen therapy might not be the answer here. To do that, we kind of have to separate what you are physically feeling from what is actually happening inside your bloodstream.
So here is the absolute crux of the matter. Medical guidelines are incredibly clear on this. Oxygen is a medical treatment for a measurable lack of oxygen in your blood. It is not a treatment for the physical feeling of breathlessness itself. And I know that sounds counterintuitive. It's a massive misconception. Most of us just naturally assume that feeling short of breath means our oxygen levels are plummeting. But the research actually shows that you can feel severely breathless even when your oxygen levels are completely 100% normal.
It all comes down to the massive clinical difference between hypoxaemia and breathlessness. Hypoxaemia is a clinical, measurable drop in your blood oxygen levels. It's objective data. Breathlessness, on the other hand, which doctors call dyspnea, is that subjective, incredibly distressing awareness of the effort it takes to breathe. You can absolutely experience one without the other. And oxygen therapy, well, it only fixes that clinical drop in your blood oxygen. To really understand who actually needs home oxygen, we've got to look at the strict guidelines set out by the British Thoracic Society. According to them, you only qualify for long-term oxygen therapy, or LTOT, if your resting oxygen saturation is consistently 92% or lower while you're in a stable condition. And they don't just take one quick reading. This has to be confirmed by specialized tests taken weeks apart, and a formal home oxygen assessment service actually has to evaluate you. It's a highly regulated prescription, not just a casual quick-fix remedy. And that strict criteria translates into a very formal clinical assessment process. Your doctors can't just guess what you need by clipping a simple little oximeter on your finger. They actually have to perform arterial blood gas or ABG tests. First, they ensure you've been totally stable with no exacerbations for 8 weeks. Then they measure your baseline, and then they very carefully titrate the oxygen. Why are they so careful? Because they have to recheck your blood to ensure that the extra oxygen isn't causing your body to dangerously retain carbon dioxide. Now, let's say your oxygen levels are completely normal, sitting comfortably above 92%, but you are still gasping. What on earth is going on? Well, you might actually be dealing with breathing pattern dysfunction, or BPD. Basically, this is when your natural breathing mechanics become inefficient. So instead of taking nice, deep, rhythmic breaths using your diaphragm, your breathing gets fast, shallow, and noisy, driven entirely by your upper chest and shoulders. That makes you feel like you just can't get enough air, even though your blood is perfectly saturated with oxygen.
You see, breathlessness is almost always multifactorial. Your gasping could be triggered by those inappropriate breathing mechanics we just talked about, or even physical deconditioning, where your weakened muscles just demand way more effort to move. And let's not forget anxiety and stress. They are huge culprits, completely throwing your respiratory chemistry out of balance. So throwing oxygen at anxiety or weakened muscles, it simply doesn't fix the root of the problem.
Okay, at this point you might be saying, hold on a minute, if I don't actually need oxygen, why did I feel so incredibly much better that one time they gave it to me in the hospital? I put the mask on and bam, my breathlessness faded. That is a totally valid question. And honestly, it's exactly what fuels the misconception that the oxygen gas itself was the cure for your air hunger. But the answer to that is absolutely fascinating. It is very often the cool air effect. When you put on an oxygen mask, a physical flow of cool gas blows right across your face. Research actually shows that this cool air hits specific receptors around your nose and mouth, sending a signal straight to your brain that reduces the sensation of breathlessness and physically slows down your breathing rate. The crazy part? You would get the exact same relief if that mask was just blowing regular, cool room air. It is literally a neurological trick completely independent of the actual oxygen molecules. Which brings us to a really vital warning. You might be thinking, okay, well,
Even if it's just a cool air trick, what's the harm? Why not just take some extra oxygen to be safe? Taking oxygen just for breathlessness when your blood levels are already normal isn't just ineffective, it actually carries severe, potentially life-threatening medical and physical risks. Let's break those dangers down. For patients with chronic lung conditions like COPD, throwing unneeded oxygen at the problem can seriously disrupt your respiratory drive. Your body can start retaining carbon dioxide, which leads to respiratory acidosis, and that is a massive medical emergency. On top of that, oxygen is highly flammable. If anyone in your home smokes, even e-cigarettes, the fire hazard is absolutely catastrophic. Plus, trailing all that oxygen tubing around creates a major tripping hazard, which is incredibly dangerous if you already have mobility issues. And honestly, relying on it just delays you from seeking treatments that actually work. You also might have heard of short burst oxygen therapy, or SBOT, where people take quick little hits of oxygen before or after they exercise. Well, the clinical guidelines are totally definitive on this too. SBOT absolutely does not improve exercise tolerance, and it does not reduce breathlessness in patients with chronic cardiorespiratory disease. The guidelines clearly state it just shouldn't be ordered for this purpose. Because of all these risks, the British Thoracic Society quality standards treat home oxygen with the utmost seriousness. It requires proper formal education, rigorous clinical testing, and continuous monitoring. You have to remember, oxygen is a drug. Just like you wouldn't take a powerful heart medication without a clear clinical need, you really shouldn't take oxygen unless your blood gases objectively prove your body is failing to oxygenate itself. So, what should you take away from all this? If you are feeling breathless, but your oxygen levels are totally fine, what can you actually do? Well, first, recreate that soothing hospital relief safely with fan therapy. Just use a simple handheld fan to blow cool air right across your face to activate those receptors. Second, look into breathing retraining. Practice gentle, silent tummy breathing, using your diaphragm to break that stressful cycle of upper chest breathing. And finally, look into pulmonary or cardiac rehabilitation to safely rebuild your physical tolerance. I want to leave you with this thought today. Knowing that your distress is entirely real, but that your blood oxygen is completely fine. What steps will you take today to retrain your breathing and reclaim your comfort? Realizing that oxygen isn't some magic cure is actually super empowering. It means you hold the power to manage your symptoms through physical retraining, pacing, and safe, proven techniques. Of course, please remember that this explainer is strictly for educational purposes to help you understand the science behind your symptoms. You must always consult your own doctor, respiratory team, or specialist before making any decisions at all about your medical care, oxygen prescriptions, or before starting any new rehabilitation programs. Thank you so much for joining me for this explainer. I really hope this helps clarify why breathlessness and blood oxygen are two very different things. Please like this explainer if you found it helpful, definitely subscribe to the channel, and check out our recommended follow-on explainers to keep learning with us. See you next time.